Hey, welcome back. It's Nurse Eunice with Florida Training Academy, and we're on our second CNA live review tonight. So, we're going to do a vital signs quiz and we'll get started in 10 seconds. I want to give you time to get your notifications. If this is your first time joining us, don't forget to like the video, subscribe to the channel, and go to our website, fltraining.com, in order to get free study guides, free resources, free practice tests to help you pass your CNA examination. And if you check back in another week, we'll have our free resources for the nursing exams, for the LPN and RN exams also. And we'll get started shortly. All right, so question number one. Hi, Mrs. Love. Question number one. Which of the following is considered a normal range for an adult's resting heart rate? Is it A, 40 to 60 beats per minute, B, 60 to 100 beats per minute, C, 100 up to 120 beats per minute, or D, 120 up to 140 beats per minute? And everybody got it correct. Hello, you all are awesome. So if you chose B, 60 to 100 beats per minute, you are correct. Anything outside this range, if it's lower than 60, we call that bradycardia. If it is greater than 100, we call that tachycardia. And don't forget that as a CNA, as a nursing assistant, you report to the nurse anytime something is abnormal. So normally, if it's within range, you wouldn't have to tell the nurse anything. You could just go to your next patient. Question number two. What is the most common site for taking an adult's pulse? Is it A, radial artery, B, femoral artery, C, temporal artery, or D, carotid artery? A favorite girl called Shannon, Buck, Mel, Remedy, Michelle. Yes, everybody has the answer correct. If you chose A, radial artery, which is located on the wrist, you know that it's the most commonly used site for taking a pulse. And then do not forget that whenever you're taking a pulse, cannot take a pulse using your thumb because your thumb has its own pulse. Instead, you're going to take two or three fingers, and the radial pulse is located in the base of the wrist near the thumb. So if you're over here, that's ulna. You want to be here for the radial pulse. And again, you can use two or three fingers, whichever you're more comfortable with using. Question number three. Which blood pressure reading is classified as hypertension? Is it A, 110 over 70, B, 120 over 80, C, 130 over 85, and D, 150 over 95. And the mmHg means millimeters of mercury. And so whenever you're inflating the cuff, how much pressure is in the cuff? So that's talking about how much pressure it takes to get the reading. And yes, everybody. So C is not technically hypertension, and we'll talk about the differences in the values shortly. Whenever that systolic is greater than 140 and the diastolic is greater than 80, we say the person has hypertension. But if you go back with C, the systolic was within range. And so we wouldn't consider that person as having hypertension. But D, with the blood pressure being 150 over 95, both numbers are higher than normal. So that would be indicative of hypertension. Great job, team. Question number four. A CNA is caring for a patient who reports dizziness upon standing. What is the most likely cause? Is it hypertension, orthostatic hypotension, tachycardia, or hypoglycemia? I am so proud of you. Yes, yes. This time, the answer is, and I'm looking at all the responses, it is B. So sometimes we're going to ask you to get orthostatic blood pressures. That means you get a blood pressure when a patient is laying, when a patient sits up, and when they stand up. And if the pressure drops, that means that they have orthostatic hypotension, and that occurs when the blood pressure drops significantly upon standing. It can lead to dizziness and lightheadedness, and that's usually when we'll put those compression stockings on a patient, those TED hose, to keep the blood flow up. Okay, so if a patient has on those tight stockings, that's why we're trying to stop all the blood from just dropping to the legs. We want to help keep it up and keep it circulating so they don't have as much hypostatic hypotension or hypotensive episodes. Question 5. What is the normal range for an adult respiratory rate? Is it 10 to 14, 12 to 20, 18 to 30, or 22 to 28? I know this one's a little bit trickier. Mel, Buck, a favorite girl called Shannon, Lynn, Fatima. Yes. So the normal adult range is 12 to 20. And once you pass your CNA test, don't forget that you can also work with pediatric patients. You can work anywhere a nurse works, but in order for you to be prepared for the pediatric population, once you pass your exam as a CNA, I need you to go back and study. And when you study, you want to also include those pediatric vital signs because, of course, their blood pressure is going to be lower, but their heart rate and their respiratory rate will be higher. So their vital signs are different than an adult's. Question number 6. A temperature of 102 degrees Fahrenheit or 38.9 degrees Celsius is classified as which of the following? Is it hypothermia, normal, febrile, or hyperthermia? And for this one, I'll take one of two answers. Sorry, I will take two of four answers. I apologize. That didn't make sense. So, yes, I see C's and I see D's. So, yes, you all are correct. And so, whenever the temperature is greater than 100, and it just depends on the population. So, I do want to backtrack there because with elderly patients, a 2-degree increase above whatever their baseline temperature is, we consider that a fever because they don't usually spike fevers the way a child would. So it's going to be rare for an elderly person to have a temperature of 102. However, if her baseline is normally 97.8 and today she's 99.8, we need to be considering whether or not she has some type of infectious process. So you'll see us treat an elderly person with a elevated temperature a little more differently. So we don't wait for them to have a temperature of 102 before we say they have a fever or that they're febrile. Question number 7. What is the best position for a patient who is experiencing difficulty breathing? Is it supine, prone, Fowler's, or Trendelenburg? What position would you place your patient? And Chindema, hope I said that correctly, and Buck, yes, you all are going to put the patient in the Fowler's position. So let's talk about those different positions. Supine is when a person is laying flat, they're on their spine. Prone is face down. We rarely put a patient in the face down position. And if they are laying on their stomach, they usually have heart monitors on them. So if a patient doesn't have heart monitors, we don't put them in prone position because every time you come by and you do an assessment on your patient, you do those hourly checks, you're supposed to be watching for chest rise. And if they're laying on their stomach, you won't see their chest rising and falling. Fowlers, you have two Fowlers. You have high Fowlers, and then you have semi-Fowlers. So if they're reclining and semi, if you bring them all the way up, it's high. And Trendelenburg is when you put them upside down on their head. And we'll do Trendelenburg for usually one or two reasons. Either the person's really heavy. If they're obese and we're trying to shift them up towards the head of the bed, we will invert their bed. We will also put somebody in Trendelenburg if they're dizzy. Usually a CNA does not put a person in Trendelenburg if it's a medical issue like low blood pressure without the nurse being present. But you will sometimes put them upside down if you need help lifting them up in bed. Let's see the next one, question number 8. A patient with a blood pressure of 90/60 is experiencing which of the following conditions? Is it hypertension, hypotension, orthostatic hypotension, or hypertensive crisis? Hi, Fatu or Fatu from North Carolina. All right. Very good, everybody. So this is really easy for you all. Yes, hypotension, a blood pressure reading of 90 over 60 is considered low, indicating hypotension. Question number 9, which of the following symptoms may be associated with bradycardia? Is it A, shortness of breath, B, dizziness, C, chest pain, or D, all of the above? You're going to get the nurse. We're going to put a heart monitor on this patient. We're going to be feeling for the pulses. And yes, you all are correct. The response is D. So whenever someone's heart rate slows down, that means they don't have enough blood perfusing throughout their body. So bradycardia or slow heart rate can lead to dizziness. Remember, the blood carries oxygen. So if their heart isn't beating fast enough, that means they won't have enough oxygenated blood, which will cause shortness of breath, and it can also cause chest pain due to the decreased blood flow. Question number 10. When taking an oral temperature, the CNA should wait at least how long after the patient has eaten or had a cold drink? How long do you want to wait afterwards? For 2, if you have been failing your written test, the recommendation that I have. All right, I'm looking at some of the answers. We have C's, we have B's. All right, so let me talk to for 2 really quickly. If you've been failing your written tests, I don't know what your native language is. If you're not speaking English a lot at home, or if you're not, watching maybe English TV shows, sometimes the terminology is going to be challenging for you. We have students who come from other countries. They have free English as a second language classes at the community colleges. And then also when you take your examination, try to take it with an audio earpiece. It doesn't cost anymore. And just like I'm reading the questions to you and you're answering them fine, when you take your test, there's usually an audio option if you ask for it, so the questions can be read to you. Okay, so I hope that helps. And if not, you probably just need to buckle down because you only get one more opportunity. At least in the state of Florida, you only get 3 opportunities, and you've taken 2 opportunities. So I would really, really make flashcards and learn medical terminology before I attempted to take that test again. Okay, and we wish you much success on your 3rd attempt. Now, with that being said, you all are not going to be happy with me because according to Mayo Clinic, it is not 15 minutes. It is 30 minutes. So the correct response for this one is D. It is recommended to wait at least 30 minutes after eating or drinking to ensure an accurate oral temperature reading. So don't come for me. Mayo Clinic, I went and I looked it up just to be sure. I know in the real world, usually we say 15 minutes, but textbook is 30 minutes. So if they've eaten or drank, wait 30 minutes and go back and recheck. Question number 11. Which of the following pulse rates is considered tachycardia in an adult? I know, Buck. You're welcome for 2. Is it A, 50 beats per minute, B, 75 beats per minute, C, 99 beats per minute, or D, 120 beats per minute? I know it used to be 15. They want us doing too much. All right, we just just don't come for me. I looked it up. Mayo Clinic says 30 minutes. And then you all are right. Gatitu, Mel, Lynn, you all know the correct response. Anytime that heart rate is greater than 120, greater than 100 beats per minute, we consider that person to be tachycardic or tachycardia. So let's talk about tachycardia. All right, I don't want to overteach because I know some of you all are not in your nursing programs yet, but usually a person will have a higher than normal heart rate due to pain. It could be due to anxiety. It's not always related to a cardiac issue. Maybe they had too much caffeine that day. So think about if the heart rate's like borderline, like right around 100, ask them how are they feeling at that time. Okay, but when it gets to 120, you want to make sure that you're starting to notify your nurse if you haven't already done so, because the patient, if the heart's beating really fast, it's going to be less blood flowing to the brain. Because just because it's beating fast doesn't mean that the heart's able to feel adequately. So it's not as much blood flow. So they can start feeling dizzy. They can also start having chest pain or palpitations. And all of that means that you do not get that patient out of bed. You keep them in bed and get that nurse in the room. Question number 12. The CNA is monitoring a patient's blood pressure and notices a consistent increase in the systolic pressure, but no change in the diastolic pressure. This may be a sign of which of the following? Is it A, isolated systolic hypertension, B, orthostatic hypotension, C, diastolic dysfunction, or D, dehydration? Only the top number is elevated. Only the systolic is elevated. So this may be a new term for you, but I want you to be made aware of it. What do you think the correct response is? All right, so if you don't know me, I do my goofy nurses dancing, and yes, everybody chose A. So you are absolutely correct. And that is called isolated systolic hypertension. And that occurs when only the systolic pressure is elevated and the diastolic is normal. And that occurs more common in older adults. Question 13. A patient reports feeling lightheaded when moving from lying down to standing up. What should the CNA do first? A, notify the nurse immediately. B, take the patient's orthostatic blood pressure. C, assist the patient to walk around. D, offer water. I know, I know. Yes, it is A. And I know what you're thinking, right? If we got a patient up to walk them around and they got dizzy, shouldn't we sit them down? Absolutely. But that wasn't one of the responses there. So you don't want to ever stand somebody up if they get dizzy. A way to prevent all of that is before you ever get a patient out of the bed, is you have them sit at the side of the bed for about a minute. That gives their pressures time to settle. So you just don't immediately get somebody out of bed. It's okay. Let me help you to the edge of your bed. And while you're putting on their shoes, that will be, like the minute that are sitting upright. And then before you stand them, you ask if they're dizzy. And you ask if they're dizzy again upon standing before you ever walk them. And if they say they're dizzy, you sit them right back down and you call that nurse. Mrs. Love, whoever registered you for your CNA exam, they should be contacting the state, or if you did it yourself, you want to reach out to the state about your exam date. Here at Florida Training Academy, we require our students to follow up with Prometric and ask about their test dates. Okay, so if you submitted your own application, that will be something that you would do. If your agency or your school submitted it, just ask them to follow up on your test date, because July 23rd is a long time for you to have waited, and you don't have a test date yet. Question 14. Which of the following temperatures indicates hypothermia? Is it 97.6 degrees Fahrenheit, 98.4, 95 degrees, or 100.2? Hypothermia. You got G. So for this one, you all, very good. So let's talk about hypo and hyper. And okay, I'm goofy, fun loving, whatever. I'm cool to work with. The way I remember hypo is when I was in college, I was so my money was low. I couldn't afford to put the other OR on poor. So when you think of hypo, it's always lower than money. If your funds are low, you're po. So, so hypo in front of a word, we call that a prefix, means that it's lower than normal. So hypo, lower than normal temperatures, would be C, 95 degrees Fahrenheit would be a hypothermic reading. Okay, so if that would happen, if you read that whenever you're taking someone's temperature, of course you want to get the nurse right in the room, and they have warming blankets, etc., they can put on the patient. Question number 15. How long should a CNA count a radial pulse to ensure accuracy? All right, and that's a lot to say, so I'm not going to say it. Just let me know what you think the best responses would be. Buck for two. Male, you all are doing so great on this practice test for two. I'm not sure how you didn't pass the first two times, so I'm definitely praying for you because you're getting the answers right. You all know that we have to count that pulse for 1 full minute. So the response is D. Counting the pulse for 1 full minute ensures an accurate reading, especially if the pulse is irregular. Brenda, F was not an option. I see you trying to cheat. Question 16. When measuring the patient's respiratory rate, the CNA should do which of the following? A, inform the patient that you're counting their breaths. B, measure right after taking the pulse without letting the patient know. C, count respirations for 15 seconds. D, ask the patient to take deep breaths. You're counting their respiratory rate. What should you do? I know Sham. Brenda put F. Yes, everybody, it is B. So now let's talk about these exams. So when you're taking the exam, especially in the state of Florida, um, you can have a skill called the pulse skill where you come in, you take the radial pulse, but then you would have to leave, do your whole exiting procedure, come back in, knock on the door again in order to do the respiratory skill. So when you're taking your test, you have to do exactly what's required for your state examination. But in the real world, while you're sitting there counting someone's pulse, as soon as you're done counting the pulse for the 1 full minute, you don't take your hand off of the pulse. Instead, you start counting the chest as it rises and falls. You want to count respirations. So that way we never let the patient know that we switched from taking their pulse to now counting their breathing. Because if they know that we're counting their chest as it rises and falls, sometimes they will unconsciously control their breathing, which means that we would not get an accurate reading. So you do what's required for the state of Florida exam, but then, or wherever state you're in, but then know that in the real world, we would do pulse and respirations together. We wouldn't leave the room and then come back and do the other vital sign. All right, question 17. I am so proud of you, Sham. I'm sending you a hug all the way from Jacksonville, Florida. I am so proud of you. Yes. Next, we're about to level up. It's time to get your diploma. And don't forget, after CNA, you can go straight to RN school, or you can take that little stop in between for LPN school, which is only a year if you're in the States. I'm not sure how long it is if you're in a different country. All right, so question 17, a patient's blood pressure is 180 over 110. What should the CNA do? Y'all know what you're about to do. 180 over 110 means that's above your pay grade. So what are you going to do, everybody? Those bees are coming through fast. Yes, let's get that nurse in the room. So question number 17, the answer is B. You're going to notify the nurse immediately because a blood pressure of 180 over 110, that's stroke level. It's dangerously high and it requires immediate medical attention. Question number 18, which of the following symptoms may indicate fever? Is it chills, sweating, elevated heart rate, or all of the above? And I kind of gave you this answer already, so I need for you to get this right. Male, you gotcha? Yes. Remember, because whenever someone's temperature is elevated, they can start shivering. So if you think about what's happening externally and they're shivering, think about what's happening internally. Their heart is now irritated. It's beating faster because now it's like, oh my God, they're cold. Let me pump more blood in order to, they're shivering. Some of them start having the cold sweats, even though they have a fever. So so we have the chills, we have sweating, we have an elevated heart rate. So even if you've not taken a person's temperature, you walk in the room and you see any of that, it should alert you to get those vital signs and to get that nurse into the room, because that can be a sign that the patient has an elevated temperature related to an infectious process. So they may have an infection somewhere. Question 19, what is the most accurate method for taking a core body temperature? Is it oral? Notice how I say this word, axillary. It's not auxiliary, axillary, tympanic, or rectal. And Miss Nubian, CNA, if you're in Florida, you pretty much challenge the test. So we do the fast track classes for CNA. So usually you can earn your CNA license within a month. If you're in Florida, every state has its own requirements. LPN school in Florida is 12 to 16 months. They do have accelerated programs where you can become a licensed practical nurse in 12 months. So it just depends on what state you're in. All right, so I see two different answers for 19. Whenever you think of a core temperature, think of a turkey in the oven, Thanksgiving. When you're trying to see if that turkey's done, you don't stick it under a wing. You go inside, you do a core temperature. So, a core temperature, everybody, is D. It is a rectal temperature. Even though we do not do rectal temperatures that often, they are still done if a patient's really sick. So let's talk about when we do a rectal temperature. Let's say that somebody had drowned. Their body is hypothermic because they've been in the water. We've done CPR on them. We got their heart restored. But now, in order for us to get an accurate temperature, because their body's so cold and they're probably intubated, so we're not going to do an oral temperature. You don't do an oral temperature if someone is either a mouth breather or if they have an airway or if they have oxygen. So what we're going to do instead is we're going to take the thermometer probe, just the tip, and we put it in their rectum. Okay, so you don't want to put too much into their rectum because if you do, you can actually perforate. You can go through the intestines. So just the tip, lube it, put it in, and that's how you would get a core temperature. And we do core temperatures when their body is too cold and would not give an accurate reading otherwise. You're so welcome, Tenzin. Question 20. A CNA measures a patient's respiratory rate at 24 breaths per minute. What is this called? Raven, I'm all over the place. I have no idea when I be live. I just be showing up, so forgive me. We have skills videos on our channel. We have a whole playlist. All right, so a CNA measures a patient's respiratory rate at 24 breaths per minute. What is this called? Is it eupnea? Is it brady? I can't pronounce that word. I never could. Forgive me. I have a master's degree, but I'm not going to pronounce that word. Is it tachypnea or is it dyspnea? and, and so for this one, it's not D, everybody. So let's talk about this. So when something is slow, think of the Brady Bunch. It was a whole bunch of kids in a station wagon. That station wagon was not moving fast. It was moving slow. So when we put Brady as a prefix, that means it's going slower than it should. Tacky, it's going really fast. Dis in front of a word as a prefix means pain. So we know that the PNEA, the P is silent, the NEA refers to breathing. So Brady, Nipia, however you pronounce it, heart is, they're breathing really slow. Tachypnea, they're breathing really fast. Dyspnea, they're having pain or difficulty with their breathing. So with that being said, the correct response for 20 is going to be C. So it's tachypnea. Okay, so that's when their breaths, they're breathing usually more than 20 breaths per minute in an adult. Notice it says in an adult because if you're dealing with pediatric patients, they breathe faster than adults. So 20 for an infant would actually be pretty slow. So before you go and apply at the children's hospital, make sure that you take time to learn those pediatric vital signs. Question 21. A blood pressure cuff that is too small can result in which of the following? A false low reading, B, a false high reading, C, an accurate reading, or D, no reading at all. Now you put that little old cuff because you was being lazy on Mr. Bobby, and Mr. Bobby is 400 pounds, and you got the regular size cuff. The cuff is too small. The cuff should take up about a third of the arm. So if the cuff is only taking up half of the upper arm, I need for you to go get a different cuff. Otherwise, the correct response, yes, everybody, is going to be B. You're going to have a false high reading. That's if it stays on the arm, because sometimes it just pops off because it was too small. So a cuff that is too small may cause a falsely elevated blood pressure reading. And the opposite, if you put on a cuff that's too big on somebody who has a small alarm, you get a false low reading. So that's why having the accurate size cuff is really important. Question number 22. When should a CNA use the carotid artery to assess pulse? Is it A, when checking for signs of a stroke, B, during a routine physical exam, C, in cases of suspected cardiac arrest, or D, when the radial pulse is too fast? Ooh, no responses yet. Mel, Novelette, Miss Nubian, you're absolutely correct. And so, all right, been a nursing professor for a long time, and you're going to end up going into, we call it the simulation lab, and you may have a actress, kind of like how I be acting in our videos, or you can have the mannequin. It's a full size adult mannequin that your professor will speak through. And the mannequin may not be responding to you. So, but if a person's talking to you, you never want to go for their carotid pulse if you're trying to check for responsiveness or a heartbeat. You go for the radial if they're talking to you. When you have to do, hey, are you okay? That's a medical emergency. If there's no response, that's when you go for the carotid artery or the carotid pulse. Don't ever compress on both pulses simultaneously, because if you do, and there was some blood flowing, you've now occluded the blood flow on both sides. So you always check just on one side. And again, you can check with 2 or 3 fingers, but never with your thumb, because your thumb has its own pulse. So the correct response for this one would be C. In the case of a suspected cardiac arrest, that's when you would go for the carotid artery. 23. Which of the following vital signs indicates a medical emergency? Is it a heart rate of 72, respiratory rate of 8, blood pressure of 130/80, or a temperature of 98.6? Which are you about to scream for that nurse so fast and get that nurse in that room? I see A or C. I see B. I see A. I see C. You all are all over the place with this one. So let me remind you that a blood pressure systolic can be 100 up to 140. Diastolic is usually 50 to 80. So that weeds out C. C is not the response. A heart rate can, for an adult, is between 60 to 100. So in this particular scenario, the heart rate 72. There's nothing that you would tell the nurse about that one. Yes, everybody, when someone is breathing 8 breaths per minute, maybe the nurse gave them too much morphine. The patient said they're in pain, and the nurse gave them an extra dose. But when someone's breathing 8 breaths per minute, that means they have a lower than normal respiratory rate. It's getting close to 0. So I need for you to try to stimulate them, try to wake them up, tap, 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 cut the lights on, get that nurse in the room. Because the respiratory rate below 12 breaths per minute in an adult could indicate a critical condition requiring immediate attention. And that's why you're supposed to count the respirations. Oh, I'm going to put the camera on big for this. Stop lying. I need y'all to really count the respirations. Everybody's respiration rate can't be 16. Y'all are not counting the respirations. Y'all will document that the respirations are 16 on somebody who is not breathing, because y'all don't assess them. So I need you to take your time when you're going room to room, actually look in the room, take a few seconds, make sure that person's chest is rising, count those respirations, because usually we find out a person has expired at the change of shift. Meanwhile, that night CNA has been documented that the patient's resting well. They weren't resting well. They weren't alive. So how we're going to figure that out is because I actually need you to pause and actually count the respirations. 8 is too close to 0. So if the respirations are less than 12, stimulate them, get that nurse in the room. All right, let me get off my little I love my patients, so I'm tired of seeing all of your documentation saying respirations are 16, because we know what you're doing. You're just making up numbers. All right, question 24. A patient with a sudden drop in blood pressure upon standing is most likely experiencing, this is easy for you because we've already talked about it, is it hypertension, orthostatic hypotension, bradycardia, or tachycardia? Thank you, Mr. Paul. And yes, everybody, it is orthostatic hypotension, which we talked about. Question 25. A CNA is caring for a patient with irregular heartbeats. What is the best way to check this patient's pulse? Do we want to count the pulse for 30 seconds and multiply by 2? Count for 15 seconds and multiply by 4? Count for 10 seconds and multiply by 6? Or count for 1 full minute? Pierre was quick. Yes, Pierre. Yes, Buck. Yes, Miss Nubian. Yes, everybody. When something, well, of course, for your test, you have to count for 60 seconds. But when you get out in the real world, you're going to learn bad habits. Anytime someone has an irregular pulse or an irregular respiration rate, bad habits need to be kicked out the door. You need to count the respirations and or the pulse for 1 full minute if something is irregular. That way we can make sure that we have an accurate reading. And you all, I am so proud of you. You all we did 2 videos in one day. That is rare for me, but I wanted to make sure that I got on here before this storm comes, because usually if the wind blows too much, we lose power in Florida. And so the storm will be here tomorrow night. So I want to make sure I got on here and gave you all your videos before the storm came. And I'll stay on for a few more moments to see what questions you all may have. But great job, team. Great job, future CNAs and future nurses. I can't wait to call you my colleagues. Miss Nubian, you only got 3 wrong. That is great. Okay, and I know you won't get those 3 wrong anymore because we actually did a whole rationale. So hopefully you understand those. Any questions, you all? You're so welcome. I don't know, is it Gatitu? I don't want to mispronounce it, but you're so welcome. All right. So if you all don't have any questions for me, I know a couple of you all have tests tomorrow, so I'll be praying for you all. And if you are in the state of Florida, in Georgia, I think the storm could be heading toward Alabama also. I'm definitely keeping you in my prayers. I want to make sure that all of you all stay safe, and I'll see you in the next video. Good night, everybody.